What is the rationale for laser treatment? VEGF is a stimulus for abnormal vessels which comes from the avascular retina. So you have to ablate the avascular retina between the ora and the ridge. So now the laser treatment is generally delivered through an LIO in a confluent pattern, and plus disease shows regression in around 90% of patients who have shown favorable outcome with this. Now, before we go into this, the selection of these cases for laser, you either pick up patients at threshold, but now currently they have said that early pre-threshold is also to be taken in the very premature babies. So the criteria for threshold is stage 3, zone 1 or 2, where 5 continuous or 8 contiguous hours are affected, or the pre-threshold, which is zone 1 in any stage, zone 2, stage 2 with plus disease, zone 2, stage 3, less than threshold. And for the ETROP guidelines, they have classified it, subclassified it into a type 1, which is high risk unfavorable, which is zone 1 any stage with plus, zone 1 stage 3 without plus, and zone 2 stage 2 or 3 with plus. Now these are the children who require treatment even if they are not conforming to any kind of the regular stages of ROP. Now what is APROP? APROP is aggressive posterior ROP. It's a very fulminant kind of progression. There's a rapid progression. There are a lot of iris new vessels, as you see on the monitor over there. The iris new vessels, that is the persistence of the tunica vascularis lentis, and it affects zone 1 or 2 with plus disease, and generally affects very low birth weight babies. Now, there are certain terminologies like a pre-plus and plus, which is arterial tortuosity and venous dilatation, more than normal, which is pre-plus. And plus is all this, plus iris engorgement, poor pupillary dilatation, and vitreous haze. These are all ominous signs which you have to look for, and these are patients whom you have to carefully follow up. This is another patient which has got the popcorn-like effect over here, and these are also patients who require aggressive therapy. Now, the laser treatment involves the use of either an argon green, that is the 532 nanometers, or the diode laser, which is the 810. And the parameters roughly are 0.1 to 0.2 or 0.2, 0.2 if you can't remember, 150 to about 350 millivolts. And you have to produce a grayish white burn. The power is adjusted to produce such burns. And threshold or pre-threshold as per the ETROP study. Now, how do you do it? Generally, you keep an anesthetist standby, or if you're doing in the NICU, even better, because there is always a neonatologist around. Argon green laser or a diode laser is used, multiple sessions given in APROP cases where there is a 360 degrees involvement, and you have to give confluent burns to the avascular area. In one session, you can give 2,500 shots, but you can even go up to 4,000, 4,500 shots because it does not cause any kind of ill effects in the retina. And the most important thing in this is that you have to treat aggressively, you have to treat soon, and you have to treat it as fast as possible. Now, generally, you start with the periphery and go on to the posterior pole. In very bad APROP cases, you do it right up to the arcade, because the thing is that these have a lot of VEGF content, and it has to be sort of done with. And 2 or 3 sessions are generally given in APROP cases to complete the treatment. I generally use a sugar pellet because it helps my patients in remaining calm. The parents are also calm with this. And I use a speculum and a depressor for this. So this is just to show you a small video of how the laser treatment is done. Okay, I'll show it to you from the main others. The treatment of babies whom you treat in the NICU, very sick babies who cannot be bought out. Dr. Mangat Dogra is a pioneer in this for treating these babies through the sloping wall of the incubator, and it is very easily done. I'll show you the small video because again, I don't know why this video is not running from here. Okay, it's coming there? Okay. Yeah, it's not playing. So this is how he's doing this through the wall of the incubator. The previous one also was playing? this is a small child. You see there is a sugar pellet in the mouth of the baby, and there is a speculum depressor. See how happily he is looking. He is telling you, when are you going to start my laser? And you just go ahead and wear your indirect, and you do the laser, and it completes it. There is no kind of issues in these children because they are very calm. The parents are generally, I keep one of the parents inside, so the parent is also happy that the child is not crying, and you can complete your process. Of course, it takes anywhere between 45 minutes to an hour if you have to do a very thorough kind of ablation. And this is how the eye looks after the laser treatment is done. All these vessels are straightened out. The eye looks quiet. It looks how angry it looks over here in the upper slide, and you see how it looks in the lower slide. And the thing is that there is a comparison between the 532 and the diode laser, and the outcomes are nearly the same. It's about 97% favorable outcome with the argan green, whereas 96.9 with the diode. And treatment in eyes with TVL, vitreous, or preretinal hemorrhages, and without inducing any kind of cataract or anterior segment ischemia or this hyphema is seen. Now, certain technical aspects have been discussed by Subhadra and Dr. Gopal. They have a paper on this, Dr. Dogra also, which they cite what kind of treatment you have to do, what are the nitty-gritties or the laser tips. So you can go through that article in the Indian Journal of Ophthalmology. And these are how the patients look before and after treatment. And the risk factors for retinal detachment development after laser treatment for APROP is gestational age less than 29 weeks, posterior zone 1 APROP, pre-retinal hemorrhages, need for repeat laser treatment, and new onset fibrovascular treatment after laser treatment. Now, a small message about the repeat laser treatment, that if you have given your full complete laser treatment where you have treated right up to the ora, confluent burns, you have packed up everything, and the thing is that, but if suppose say you find there are certain skip areas, because most of the times the progressions are because of skip areas which may be there, so revisit this place, see if there are areas which are left out. Please do a fill-in PRP for those areas. If you want, you can ablate part of the posterior pole and see whether it goes down. And if this doesn't go down, then the next recourse is that you have to give an anti-VEGF injection. Thank you so much for your kind attention.